Okay, so just real briefly, I'm going to go through a couple of the hematologic conditions that are more common in your pediatric population. As I said, I'm not going to go into a lot of depth about these, but I am going to at least talk a little bit about the ones that are most common in the pediatric population. Anemia, is common in your pediatric population. The signs and symptoms of anemia are the same for kids as they are for adults. They get fatigued, they can be short of breath, they can complain of headaches, they can have difficulty concentrating, they can have dizziness, they can have pale skin. So obviously for nursing care, we want to identify the underlying cause, figure out what is the etiology of the anemia. Give blood transfusions if necessary, if the anemia is significant enough. Uh, Promote more healthy eating and vitamin supplements if necessary, and any hematopoietic growth factors that they may need if they have some sort of a problem with their hemopoietic system. Iron deficiency anemia is probably the most common type of anemia that you'll see in the pediatric population. If it's mild, a lot of times it'll be asymptomatic. But they have decreased hemoglobin and hematocrit. They may, if they are showing symptoms, they may be irritable, they may have fatigue, shortness of breath, decreased activity level, pale skin, and delayed motor development. Toddlers, I'm going to use them as an example. So if you have a toddler who drinks a lot of milk, they may be more at risk for iron deficiency anemia because the iron will bind with the calcium in the milk. So that can lead to iron deficiency anemia. So nursing care, obviously we want early identification. We want to understand the primary goal is to prevent the problem from occurring. Any nutritional counseling that they may need, any supplements that they may need. Uh, if it's an issue that they can't afford a lot of different foods, if they have limited income, we want to discuss the WIC program with them. And then oral iron supplements if that's necessary to try to help them to improve their situation. Along with your iron supplements, you also want to make sure that they're doing vitamin C. So if you're giving them an iron supplement, have them drink a glass of orange juice along with it because that helps the iron to be absorbed. It can cause constipation or it can cause the tarry stools. So we want to make sure that we're educating the parents about that also. Nosebleeds are very common in your pediatric population. They can be for lots of different reasons, but the most common reason could be that the nasal passages are dried out. They're very delicate tissues up in there, and if they get too dry, it can cause them to bleed. Obviously, we want to avoid aspirins or NSAIDs because that can increase the risk of bleeding. If they do have the dry passages problem, you can tell the parents to get a humidifier for the kiddo's room. First aid measures to stop the bleeding. You want to sit forward. You want to apply pressure to the nares that's bleeding. You don't want them to put their head back. You want them more to lean forward. Obviously, if they can't stop the bleeding, you want them to come to the emergency room right away because they can lose a lot of blood with a nosebleed. And we want to make sure that the parents understand that if they can't get the bleeding under control in a short period of time, they want to bring their kiddo in right away. Sickle cell anemia is one of a pretty common type of anemia that you may see in your pediatric population. You've probably learned a lot about this in the adult population, but it can also occur in your pediatric population. The presentation, again, it's the same. You have the sickling of the red blood cells causes them not to go through the arteries or the vessels, pardon me, as easily, so they clump up. It can cause pain in your chest area. It can cause pain in the joints. It can cause issues with oxygenation because you don't have that oxygen carrying vehicle anymore. It's more common in your African American or Mediterranean population. If they're in a crisis, obviously we want to provide prompt treatment right away because, again, it's very painful and they can have issues with their oxygenation. So we want to make sure that we're educating parents that have kids with sickle cell disease, that we want them to provide treatment really quickly. We want to get the kids in and get them treated if they're having a crisis. So some symptoms with the sickle cell disease, pain obviously is the number one symptom that you're going to see. Obviously they're anemic. They're going to be kind of pale. They may have fatigue and weakness. They may have activity intolerances. They may be at an increased risk of infections. They actually could have strokes because of the clumping that occurs. Tissue hypoxia, again, we don't have that oxygen carrying capacity or reduced oxygen carrying capacity. Jaundice, again, because of the clumping, the cells break down and they release the hemoglobin or the bilirubin, pardon me. So that could put them at an increased risk of jaundice. Some nursing care, obviously early identification and treatment is necessary, providing O2 and hydrating them. They're going to be on fluids, controlling their pain. Again, morphine sulfate is the drug of choice when you're talking opiates. A lot of times when these kiddos come in a crisis, they're going to have them on a PCA. Encourage rest, clustering care, making sure that they rest in between care, and then again, providing education for the family. Hemophilia, another common type of blood dyscrasia. They present with bleeding, or if they have a known family history of bleeding disorders, if they have bleeding in the joints, which is called hemarthrosis, or soft tissue bleeding, those are some of the signs and symptoms. They cannot clot, so they definitely have a risk of hemorrhage when they have an injury. So with these kinds of kids, you obviously want them to avoid contact sports, things like football, because they're more at risk for injuries that way. Ensure that they're being safe, prevent any complications, and obviously providing education. There are certain factor products that the parents can be educated to administer if the kid is having a bleeding issue at home. Before they have to bring them to the hospital, but they definitely want to keep the provider in the know. They want to make sure that the provider knows what's going on. Okay, so this is a pictorial representation of hemophilia. There's no cure. Avoid injury and meds that promote bleeding. So again, avoiding the NSAIDs and aspirin. Good nutrition, good dental hygiene. Dental hygiene always seems to come in. IV administration of any deficient clotting factors that they may have. Increased risk of intracranial hemorrhage because again, they're not clotting, so they're going to bleed. Prolonged nosebleeds if they have this condition. They may bruise easier. If they have the hemarthrosis, they may have warm, painful, swollen joints with decreased movement of those joints. And GI hemorrhage sometimes can be a problem as well. With some of these hematologic conditions, if they do require a blood transfusion, the process is the same as it would be for an adult. You are going to be double checking, identifying the blood. You make sure that you have a consent. If you do have a Jehovah's Witness, they are not going to consent to blood transfusion. That's not part of their religious practices. So you obviously want to be aware of that. Type and cross matching if a blood transfusion is going to be necessary, the 4-hour time limit for the bag to be hung. All of the same types of nursing care and nursing responsibilities will apply whether it's an adult or a child. Institutional policies, obviously you want to know what your facility's policies are when regarding administration of blood products, and accuracy of your patient verification. Obviously we want to make sure that the right patient is getting the right blood. Remember the 2 identifiers. Don't forget that. That's an important safety measure when you're doing blood transfusions. Okay, so transfusion reactions, again, it's the same as it would be for an adult. They have an increased risk of a reaction at the beginning of the transfusion. So the hemolytic reactions are more common at the beginning of the transfusion within about 10 or 15 minutes. Your ones where they get a fever, so the more infective type of reactions can occur throughout the transfusion or even when the transfusion is completed. Obviously, we want to be aware of the signs and symptoms of a reaction. If they're very fidgety, if they're restless, if they're anxious, if they're having any back pain, if they're complaining of any pain in their joints. Obviously, if they have a rise in their temperature, we're taking their blood pressure a lot. We're checking their blood pressure, their temperatures. Children who receive multiple transfusions, obviously, the more transfusions that a person receives, whether it's an adult or a child, they're going to be at an increased risk of developing a reaction with the next transfusion. So if you think about a child that has some type of cancer, they may require transfusions more frequently than a kiddo with a hematologic condition. So that child is going to be at an increased risk for a reaction because their body is going to develop antibodies with each transfusion that they receive. Febrile reaction, so if they start to get a rise in their temperature, you're always checking their vitals before the transfusion starts, and then you're checking them frequently throughout the transfusion. So you have to remember that they can still have a reaction even after the transfusion is done. So you still need to be monitoring them. Fever and chills, which then progress to more serious complications like tachycardia, tachypnea, or hypotension. So sometimes we pre-medicate with Tylenol before the transfusion starts. It's not going to necessarily prevent the reaction, but it will help to ameliorate some of the symptoms that the kiddo may incur because of the reaction. Obviously, if we feel like a transfusion reaction is occurring, we want to stop the transfusion right away. We want to remove the tubing and take everything off and start a saline infusion. And obviously, you want to notify your provider right away. The hemolytic reaction is your most serious reaction. This is one that people die from, and children are no exception. That's where they have a mismatch in the blood, and it causes the cells to hemolyze. And the body responds to that transfusion as an invader. So they'll have fever, they'll have chills, they have pain at the infusion site, they may have a tightness in their chest, they may complain of difficulty breathing, they feel that impending sense of doom, like they feel like something bad is going to happen, they may get very pale, or they may get jaundice because of the breakdown of the blood cells. They may actually have nausea and vomiting, flank pain, red or black urine, progressive signs of shock such as tachycardia and hypotension. Obviously, you want to stop that transfusion right away. We're going to be monitoring their vitals, remove all the tubing, everything, and start a saline infusion. Verify the patient's identification, notify the provider right away. They're probably going to want blood and urine samples to be sent. That's usually policy in most facilities. And obviously, just watching your patient. You're not going to be able to leave the patient if this is occurring because, again, this is life-threatening. And making sure that your families are notified and involved, making sure that they understand what's going on, that you're supporting them, because this is a really scary thing when this kind of a reaction occurs. Bone marrow transplantation, if you have a kiddo with some sort of bone cancer or maybe leukemia, which is the most common type of cancer for children, hematopoietic stem cell transplant or bone marrow transplant, those are the two different kinds. So again, the nursing care is the same for a child as it would be for an adult because the symptoms are the same for a child as they would be for an adult. There really isn't any difference. The three types of stem cell transplants, the autologous, which is the child's own stem cells, allogenic transplant, which is a matched compatible donor like a sibling, or synergenic, which is an identical sibling. Obviously, their DNA and everything is going to be exactly the same because they're identical. Some complications that may occur from a bone marrow transplant, they get the graft versus host problem. And that's a pretty significant issue. That's the more life-threatening type of problem. Infection, obviously. Immunosuppression, because, you know, the bone marrow is where your immune cells do come from. Organ dysfunction, that's a definite potential problem. And a psychosocial impact. There's a lot of that involved with a bone marrow transplant, especially if you're getting a transplant or you're having a donor that is a family member, maybe a sibling or an identical sibling. That can cause a lot of psychosocial impact. Okay, so that was just a quick overview on some of the more common hematologic issues that you may see in your pediatric population. So if you do have any questions, please let me know.